Sweet. Welcome back to the Wet Dreamz Podcast. My name is Jose Gonzalez. And if you've been listening, you know, but I'll say it anyways. I'm specialized in men with out of control sexual behavior. And I'm a licensed mental health counselor and a sex therapist. And I'm one of your hosts. And this is...
I'm Dr. Brad Hinman. I am also a licensed professional counselor and a licensed marriage and family therapist. And I'm also a nationally certified sex therapist.
Awesome. So today, as I told you before the episode, we're bringing it full circle. You know, we're kind of going back to the beginning of why we created the podcast and then just going a little deeper. This is the second to last episode. This will be a two-part thing. It's the same topic, but we're close to finishing the first season. That's wild. It's insane. Yeah. Insane. So I think to remind you, if you remember from our first episode, the reason we created this topic and the reason you and I kind of is spawned out of is this idea of faking it till you make it, or trying to fake like you know what you're doing, or whether that's sexually, whether even just regular. I think there's a lot of pressure on guys to be a certain way, to act a certain way, to provide, to whatever, you know, or sexually to be able to just have sex at will, have an erection at will, all of that stuff. And I think the goal or the aim of our podcast was to talk about it and to like tell our guys, like, you don't have to be that, like, you don't have to fake it, you know, you're enough, really. I think that's almost like the theme that a lot of guys that we see struggle with, this idea of not being enough. But what comes to mind for you, this idea of like faking it till you make it? What's been your experience with that? I think
I think the things that you mentioned, right? Like always having to be ready, having to know a lot about sex, right? There's some of our clients come to us, they were, virgins up until they got married. But then boom, on their wedding night, they're supposed to know everything about sex. And so out of desperation to make that happen, guys access porn to learn about sex. And then, as we've said in other podcasts, like porn is not it's not a teacher, right? So they expose you to all kinds of stuff that's not realistic. And so there's pressure on that. I think that there's a lot of pressure on men to, like you said, always want sex and always have to be ready for sex. And so even during sex, there's some faking it till you make it. I've had guys talk to me about they're imagining porn when they're having sex with their partner, or they're imagining previous partners when they're having sex with their partner. And they're doing that not because they don't love their partner. They're doing it because they're afraid they're going to lose their erection, which is another huge pressure that men have, is having to maintain their erection. They feel pressure to maintain their erection all throughout sex until they ejaculate. There's a lot of stuff in the media about women faking orgasms. Men can't really fake ejaculation because there's a substance that's supposed to be there, right? Unless, of course, they ejaculate inside of the body. But then even still, there's ways. Yeah.
Right.
And so it's harder for men to fake orgasm. And so, but they do feel tremendous pressure to have an orgasm, or to have an orgasm, but also to have an erection throughout the whole sexual period. And also another thing that kind of a myth that porn teaches us, which we should have included in the others, is that men are supposed to last like 3 hours while they're having sex. And that's not normal. That's not right. The normal human male does not do that. I'm sure there's some people out there, don't write us letters.
Right, but I can.
Yeah, I'm sure there's people out there who can. But that is not typical, right? Yeah. The average length of once penetration happens, the average length is 7 minutes. And so not 3 hours.
Yeah, not even close.
Right.
Not even close.
And so that's another kind of fake it till you make it thing. I've had guys tell me that they masturbate before a date or before a sexual encounter with their partner so that they can last longer. And they learned that from porn. Right?
Yep.
Maybe not the masturbation before sex, but they learned they're supposed to last a long time from porn.
Right. Yeah, I mean, and you hit the nail on the head of exactly what we're going to talk about, which is classic. So there, I feel like I broke it up into sexually faking it and then emotionally faking it, because there's also this idea of, how you're supposed to present yourself as a man. And that will probably be part 2 of our 2-part series. So we can focus today on sexual, but you're in that you hit the nail on the head. There's this sexual parts that we can fake it like internally and mentally, thinking about your favorite porn scene while you're having sex, to maintain an erection or whatever. Yeah. The sexual part. And then there's the emotional part. So, what are some other expectations that men have taken on to try to make themselves to that level? I know, like having a big penis, like that's not a realistic expectation, but that is an expectation that comes with being a man and having sex as having good sex as a man is having a big penis.
Right.
But,
yeah, because men, again, they learn that from porn. They think that the bigger the penis, the more likely that the person is to have, their partner is to have an orgasm. That's not true either. And so, and there is some shame to men thinking that their penis does not measure up to what they see in porn. But what people don't realize is that the average size of an erect penis in porn is 2 to 3 inches bigger than the average size of a male erect penis in the general population. And so the porn shows unrealistic things. And so we should not use a commercially prepared video to like run aspects of our lives, right? Like it's commercially prepared, so that means it's fake, right? And so we don't do that with other things, right? We don't think that webs are supposed to fly out of our hands because we watch Spider-Man, right? Like it's
right.
But we do that with porn.
Exactly.
We think that we're supposed to, penises are supposed to be huge, or other body parts are supposed to be whatever, because we watch porn, or we're supposed to last this long, or people like to be slapped, or people like to be ejaculated on. Like we get all these myths from porn that aren't true. But again, we covered that myths about porn in another episode.
It's similar. It's like it's close in that way, but it's a little bit different. I think the myths and expectations, because another one, the myth is, as far as like erections, the myth is that you should never lose your erection during sex, and again, the expectation is also then like you as a man should be like, viral, like erection that's like the hardest erection ever for 3 hours. Like it's something like animalistic about it, how you should be as a man, but we know that throughout that interaction you lose the erection, you get it back, whatever, there's some waning and waxing and waning of what the erection looks like during a realistic like sexual encounter.
Yeah, and so I think that to connect the myths and the expectations, I think we have expectations because of the myths,
yes,
right?
Exactly. So that's a better way. Yep, that's what I was trying to say.
Just to put that in the right order, I suppose.
Right, for sure. So what are some other, for example, high sexual desire? We've talked about that a little too, but there's a myth that as a man you should have a high desire to want to have sex, and you should be ready whenever, wherever to have sex, you know what I mean? And there's this idea that, again, it's very animalistic, it cuts out the emotional part of sex for men almost, where it's like instinct. You get horny and you go and you have sex and you're lasting for whatever, you know what I mean? Like it like really cuts out that like emotional piece of it.
Right. It makes men almost become machines, right? Like that we're not allowed to not want to have sex. We're supposed to want to have sex all the time. We're supposed to be ready all the time, rock hard and last for 3 hours all the time. And, we're really not even supposed to want to talk afterwards or before. We're not really allowed to want to cuddle. And so there's a lot of expectations around sex with men. There's a lot of expectations around sex for women as well.
Yeah.
But I think it's like we are not taught at any age to like how to negotiate for sex, how to turn down sex, how to say, well, I don't really want to do this, but I want to do this in sex. Like we're really just not allowed to have those conversations. And we're really not taught how to do that. Right. And so there are a lot of expectations that are societal pressures, because of, I suppose, not really tradition, but sort of like we've always done it that way. Right.
Right.
And so, yeah, there's a lot of expectations around sex.
Yeah. And you bring up a good point, about the cuddling thing. Like, my brain starts to wonder if that was something that we allowed men to do more. Would it happen more, in the sense of, I think that's another one of those expectations of, like, it's almost weird to think like that the man would want to cuddle more than the woman or whatever, like the cuddling before and after, and I don't know if I don't know what it is, but I don't know if it's like the utilitarianism of it, of men are kind of like get in, get out kind of deal, I don't know, but I feel like that there is this need of emotionality that guys don't even realize they need, but it's part of the equation that as men it's not in the picture. You know what I mean?
Yeah. Yeah. Well, and that's what I talk to my couples and to my single clients as well, that if they ask somebody for sex and the answer is no, traditionally everything's off the table. Like it's time to go clean out the garage or something, right? Like all interactions stop, all conversations stop, and then the two of you separate physically. And so I tell people, if you ask for sex and the answer is no, you can still interact. You can still cuddle. You can, hold hands or put your arms around each other and watch a movie or whatever. Like there's a lot of physical interaction that you can still have. You can do activities which we would normally talk about as foreplay, right? You can mutual masturbation. You can incorporate toys. There's a lot of things that you can do that doesn't involve sex, right? Like it doesn't have to, it doesn't have to like disappear, like all physical interaction disappear. Like you guys can still interact together sexually without having penetrative sex. And so that's another expectation I think that guys are raised with, is that, oh, she looked at me for more than 3 seconds, that means we have to have sex now. Or she touched my arm when she walked by, that means we're going to have sex now. Or, she complimented me, so that means we're going to have sex now. Or, like there's a lot of expectations for men to turn everything into sex, right? Because we're always supposed to be ready and we're always supposed to want sex. But then men get a lot of bad press or whatever, because
flack maybe.
Because we always want sex, but we're always supposed to want sex.
Exactly.
Right?
Yeah, it's a lose battle.
Yeah.
Definitely. That's true. Yeah. It's like guys are just trying to stay ready, I suppose. I don't know, or it's just so interesting how that not double standard, but the double message, mixed message is, if you have a high sex drive, that's not desirable, but you should have a high sex drive and be ready at all times.
Mhm.
It's just weird. You know, I mean, and that brings to the next point of like another expectation regarding sex is that it always feels good, or also this idea that popped into my mind is like, if there is pain, so I mean, you talk about pain with women more often, I feel like, but
Mhm.
for guys, if there's pain during sex,
Mhm.
then you just push through that,
Mhm.
and you're like, well, that's fine, it's whatever, you know. The same idea of like saying no to sex, it's the same idea of stopping a sexual interaction if it's not pleasurable, if it's painful or uncomfortable or whatever, or negotiating for what you want. I think that's another expectation sometimes that I see some of the clients. It's like push through, or like it doesn't matter. Like the main goal is the main objective is the end, you know. So you're just pushing through, you know.
Yep.
Again, as a man, you're supposed to be able to just hunker down and
Yeah.
friggin'
Yeah.
you know, like
Like a machine.
like a machine, right? Pain or no pain,
Yep.
erection, no erection,
Mhm.
go, just
Yeah.
go, you know. Yeah.
It's true. And there's lots of ways that men can experience
Mhm.
pain during sex as well. You know, the testicles could get bumped, or you know, our knees or our elbows get sore, you know, like our
Yep.
back gets sore. And so like we're still humans during sex, right? And so yeah, ignoring pain, and pain can cause somebody to lose their erection, right, as well. And so
Right.
that's why, you know, when I talk to men about masturbation, I tell them, you know, stop partway through masturbation and change positions, because that's going to help you when you're having sex with somebody and you have to change positions for you to not lose your erection.
Exactly. Yep. Uncircumcised penis in certain positions will give pain. I don't just that popped in my head, but yeah, right, for sure. Any other expectations that come to mind when you think about? I mean, that's a lot. We've gone through a lot, but I'm sure there's maybe more. I don't know. I got one, like younger people have better sex than older people. That's maybe a myth and expectation. I don't know, like younger people having better and more sex, more and
Right,
better sex.
better and more, yeah. and I think that's true. That's an expectation, right? If somebody's in their 20s, they're supposed to be having tons and tons of sex. And so, and I get clients who say to me, "Hey, I'm in my 20s and I don't really desire to have that much sex, or my partner isn't available to have sex that often, or whatever," right? Like I think that is an expectation. And so, but on the other hand, there's like people in their 60s and 70s and beyond are actually having more sex now. And actually people 18 to probably 25 or 30 are starting to have less sex. And so there's lots of speculation as to why that is. But one of the reasons given in scholarly research is that, you know, there's less worry about getting pregnant when you're in your 60s and 70s and beyond, right? And so there's also the theory that among the people being surveyed, that sexually transmitted infections are less during that age, but actually people in their 60s and 70s and beyond are having more sexually transmitted infections because they're being promiscuous or whatever, they're sleeping around because of there's no chance of getting pregnant. And so they're passing STIs to each other. Right.
I think I've seen that, like in nursing homes and skilled care facilities, an increase in STIs. They're getting freaky, if you will. I don't know. Right. So the expectation is that sex ends at a certain age or whatever, or at a certain age, as well as with an erectile dysfunction, for example. Like, okay, sex is done. Like, you can't have an erection. And you're above 60, so you might as well stop. I mean, I'm sure, and I feel like either maybe you had said that, or I may have had a client where essentially the doctor said something like that, like, "Oh, important then for you. It's not really important for you to have sex. And it's like, huh?
Yeah. Oh my
the
goodness.
heck?
Yeah.
What do you mean? Like, do I just die then?
Right.
You know, like, it doesn't make sense.
And it's not really up to the doctor to decide that.
Right, exactly.
But that is unfortunately the idea, right? That nobody wants to imagine their grandparents having sex,
right.
And so, but that doesn't mean they're not, and that they won't enjoy it, right? And so there's lots of things that we can do sexually that beyond penetrative sex with orgasms.
Mm-hmm. Exactly. Right. For sure. Yeah. Any other expectations? I wrote down being smooth and romantic. Body type, having muscles, 6-pack. That's a expectation that men on men. I feel like.
Mm-hmm. Yeah. There's, it's interesting because I've had some men with body dysmorphia, which means like that's when you look in the mirror, you don't see the same thing that other people see when they look at you, right? Like the same body type. So like anorexia and that sort of thing, most people could probably familiar with that. That with a person with anorexia, when they look in the mirror, they see a fat person, but when people look at them, they don't see a fat person. But body dysmorphia in men sometimes show up as they can be very physically fit. If I look at them, I think, oh, this person's physically fit, but they think they're fat, or they think they don't have any muscles, or that they don't have a 6-pack, and so what they're seeing is not what other people see. So often, what I'm trying to say is body dysmorphia in men show up as I don't have enough muscles, or I don't have big enough muscles.
Right. It's almost, generally almost opposite in the sense of often for women is that they're too fat. Yeah. They need to lose weight, whereas men is they need to be more muscular. They need to gain muscle or gain size in their penis, whatever, It's like, it's interesting how those kind of mirror each other. For sure. Yeah. Yeah. Well, and then that affects how your self-esteem, how you view yourself. So this, I'll ask it as a question, I guess, but what are the effects of these expectations on men? What are some of the effects that you've seen? I kind of just started it off by saying like self-esteem, like comparing yourself to these unrealistic images makes you feel, and like I said earlier too, the not enough thing. I feel like that's a huge theme in the guys that I see, this idea of feeling like they're not enough, whatever it is, and not even just sexually, but just in general, feeling like they're not doing enough, they're not enough as a person, whatever, What are your thoughts?
Well, any kind of stress or pressure can interfere with somebody's erection, right? And so that's probably the biggest thing. Yep. But also these expectations are going to make you enjoy the sexual encounter less, right? That if you have these expectations or these pressures pushing on you, you're not going to be as in the moment, and you're not going to be able to enjoy yourself as much, right? So just kind of letting go of what should be and what is expected of me, and just enjoying your partner for whatever the encounter is that you're having right now. So that's another kind of side effect of these expectations. And so, but we also have expectations from ourselves. I think those are societally imposed, and we've kind of incorporated those into our own being. Yeah. But we put pressure on ourselves, is what I'm saying, right? Like we, what do I look like? And is she going to like me? And, how do I smell? What is she going to think when she sees the size of my penis? And, all these things are expectations, where if your partner loves you enough to be in a sexual encounter with you, that stuff probably isn't even going to be on their mind, right? It's not. Right. Yeah. It doesn't, that's not going to matter at that point.
Right. Definitely. Right. So So it's getting in your own head, and and nothing makes anyone feel less sexy than not feeling good about themselves. Right? That's the biggest barrier for how you feel internally or whatever.
Right.
And I think, guys tend to withdraw, when they feel lower self-esteem or when they don't feel good about themselves. They tend to withdraw or they go to their garage and work on things, or they keep their distance from their wife, or don't open up from the partner, don't open up emotionally or whatever. So I feel like that's the biggest thing I see with guys that come in. It's a shame thing, I guess. I don't know, but when all those factors are weighing on you of man, I'm not this, I'm not that, I'm not as good sexually, whatever, they tend to go into a ball into themselves, you know what I mean?
Yeah, they retreat into themselves, and then their partner's like, why don't you ever talk to me about your emotions? And so then they retreat more,
right?
And then the partner wants more from them,
right?
So it just keeps it just keeps snowballing, right?
Well, then it's I'm not a good partner. I don't know how to open up. So then I'm gonna retreat. What do they do when they feel bad? They're gonna retreat again. You know what I mean? Yeah. Right.
And I think it starts, as with children, we don't teach young boys how to talk about emotions. We don't teach them really anything. We don't teach them to have emotions. We don't teach them to label emotions. We don't teach them to talk about their emotions. And because of that, then when they're in a partnered relationship, they don't know how to talk about their emotions, and they don't know how to label their emotions, and all that stuff is present when they're in relationships because it was not present, or the same thing was present when we were children, is not being able to have a voice, right? And so, and then it causes, like you said, the male to retreat more internally, because it's not safe to be in public and have emotions. And so it causes more retreat, and then like I said, the partner will, why don't you talk about your emotions? You never share your emotions with me. And then the person's going to retreat more.
Right. The cycle for sure. Yeah. And again, we'll talk more, I think we'll get into a little bit more of the emotional part next time as well. A little bit deeper, but that's definitely part of the effect that not feeling good sexually has. It relates to the emotions. Yeah. So any other expectations that come into your mind about sexual expectations? I feel like we touched a lot of them.
Yeah, I think we did. One other one that's popping in my head is, men are supposed to be, smooth, right? Like we're supposed to make people's clothes fall off, just yeah, with a pickup line or whatever, right? Like we're supposed to have all these cute little pickup lines or something. I don't know,
yeah.
It's
they call it Riz these days.
Oh, really? Okay.
Yeah,
right.
Just FYI.
Good to know. And so, how about you just ask the person, hey, is sex on the table? Is that going to happen? You don't have to have some elaborate ruse, right. to trick this person into taking their clothes off. If you want to have sex, just ask them if they want to have sex, and then you're having sex. It can be that simple. Right? It doesn't have to be. We don't have to feel the pressure to kind of woo this person, or trick them into wanting to have sex with us, right? By some weird combination of words, right? We don't. But I think men do feel pressure, right? We feel pressure especially if you're going to a public place to meet potential partners, right? There's this pressure to be super conversational and like I said, make somebody's clothes fall off just by talking to them. And romantic, that's another that's another phrase that I hear a lot in therapy is he's not romantic enough or I'm not romantic enough, right? Like
that'll definitely come up in part 2 for sure.
Okay.
That's a big one. I'm gonna like redirect now, but that's huge, the romantic piece. But going back to the being smooth and stuff, it almost feels like there's this like it has to be unspoken. All of these things are like you have to exude or you have to, all these things are, you're not talking. I don't know, you know what I mean? You have to have a big penis. You have to be able to go at any point, where she touches you and you're ready to go. You have to last a certain amount. You have to be smooth. What else did you say? You have to have a high sexual desire. All that stuff it's not, there's nothing like present about it. Like you're just passive. It's weird. You know what I'm saying? Like,
right. You're not in the current moment. If you're worried about all those other things floating around, right, then you're not in the present moment with your partner.
Right.
Having fun, right? You're not enjoying yourself because you're worried about all these other things.
Right. And instead of being more direct, like you said about the being smooth thing, you're almost having to convince someone else that you're good or something, or you almost have to, like you said, like a ruse to get somebody's clothes off. Like as a man, you're supposed to be able to do this stuff sneakily. I don't know. It's just a weird thing. And the minute you're like expressing what you want for real, that's just weird, or that's too forward or whatever. You know what I mean? Like it has to be like, you have to backdoor thing, not to use a sexual pun, I guess, but you have to like backdoor your way into these things. It's just very weird to me. We're not allowed to talk. I think we're not allowed to express, but we want, but then we're supposed to be able to express too,
right?
But we're not allowed to. It's just ridiculous.
It is. It's just throw in all these rules and just make your own. Like what's going to make you happy and what's going to make your partner happy. That should be the only things that are on your mind.
Exactly. So going on that, and this will be kind of how we close because I don't want to give up too much for the next one, but and we'll do this the same way emotionally, I think too. So the question that came to mind is like, how do we, specifically sexually, how do our listeners, how do we be more genuine? How do we stop faking it in sexually specifically? And again, next time we'll talk about emotionally, but how do we stop faking it and be more genuine?
I think talking, that's always going to be my go-to answer. Like I think first talking to yourself, what are my expectations from this encounter, right? So if you're going on a date and hoping for sex, or whether you've been with your partner for 50 years and you're expecting sex, like excuse me, what are my expectations for this encounter, and what do I want to happen after? Like, and so talking about what you need, talking about what you want with your partner after you decide yourself what I need and want, having a discussion, and if your partner is not in agreement with you on what they want, if what they want is not in agreement with what you want, then can we do some kind of compromise, right? Can we just cuddle? Can we hold each other? Sometimes with couples, I get the fear from the person who doesn't want sex, that they're like, well, that's just going to lead to sex. He's just going to want sex if I cuddle with him. Well, not if you make the boundary ahead of time. The answer to sex is no, but we can cuddle, right? And so then I tell the partner who is going to want sex, I'm like, you can't, if your partner says no to sex and they want to cuddle, then you can't want sex while you're cuddling, because then they're not going to want to cuddle with you next time either. You're not going to get sex or cuddling, right? So you need to maintain that boundary, respect their boundary, respect their what they want and what they like and what they don't like. But I think communication is the biggest
Yeah.
way to kind of dispel some of that expectations.
Yeah, and along the same lines, you talking about the talking to yourself, I think I would add the personal component to our guys, like figuring out what you like, what's your personal pleasure, how do you like to be touched, and the self-esteem piece, like figuring out what, the core of why the issues that you feel bad about yourself or whatever. I think part of it starts with the internally doing their own individual work at times too, like accepting the differences in their body, you know what I mean, knowing that my penis is this size and this is what it is, but how can I work within that, so I think there's some of that individual work that can be done, so then you can express that to your partner and be like, wait, this is what I like, this is what I want, this is my expectations for this certain experience or whatever, or this is what I bring to the table. I think within that communication is also figuring out what they want and who they are, all that kind of stuff, which is, it's a lot of work for sure, if that comes with educating yourself or reading books or going to a therapist or whatever. I think as guys we don't do that enough, where we don't dig into our stuff as much as we should, because ultimately that's going to allow you to express yourself better to the person that you love or that you want to be with, or express yourself sexually to, like, this is what I want, this is what I like, and that's cool. Can you do that to me? And you find a middle ground or whatever. Can you give that to me? Anyways, so I think there's that individual work too that our guys need to do, and they do when they come see us. Right. It's hard work.
It is
for sure.
Well, I think most people fall in love with people and personalities. They don't fall in love with body parts, really. And so, yeah, we all have things that we're insecure about with our own bodies, but that's not really going to be a make it or break it with your partner, or it shouldn't be, really. Right. And if it is, maybe you're with the wrong person.
Yeah, right. That's exactly what I was going to say.
It's like most people are willing to overlook deficiencies in favor of a personality that's a match for theirs, right? So, like I don't think people get as hung up on your body as you do. Right.
And also once that front end things fade, the expectations, sex, how smooth you are, blah blah blah, what are you left with? And really that's the thing that matters.
Right.
Right. And that's the thing your partner falls in love with you for. Whatever. That's what they fall in love with.
Yes.
Exactly. Cool. Like I said, we'll have a second part. Did I miss anything today? What are your thoughts? Any last thoughts?
That was my last thought.
That was the last thought. Yeah, I should have just stopped
our body parts don't matter as much as you think they do.
As you think they do. 100%. 100%. Cool. Yeah, I think the next we'll kind of take a similar vibe, but we'll focus next time emotionally, because that's a huge thing as well of the expectations that our guys have emotionally. So appreciate you guys listening. We'll catch us on the second one, emotional, fake it till you make it emotional one. And if you guys have any questions, feel free to check our socials, Wet Dreamz with a Z podcast, Facebook, Instagram, TikTok, YouTube. Check it out.
Yeah. Thanks for joining us.
Thanks for listening. Here's just a tip. As men, it can often be hard to show exactly what we are feeling without being judged by others or even ourselves. Here are 3 tips that can help you improve your authenticity. 1. Get to know yourself. Authenticity starts with self-awareness. Take the time to reflect on your values, beliefs, and personal strengths and weaknesses. Understanding who you are and what matters to you allows you to align your actions with your true self. 2. Embrace vulnerability. Authenticity often involves being open and vulnerable. Don't be afraid to show your true emotions and share your genuine thoughts and experiences. Being vulnerable doesn't mean weakness. It's a sign of strength and courage. 3. Be honest and transparent. Authenticity is closely tied to honesty and transparency. Strive to be open and truthful in your communication. This includes being honest about your feelings, intentions, and any challenges you may be facing. For more tips like these, check out Wet Dreamz Podcast on most social media platforms. The Wet Dreamz Podcast and any content posted is intended for general information, educational, and entertainment purposes only. We are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional, diagnosis, or treatment. Listeners should not disregard or delay in obtaining a medical advice for any medical or mental health condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.